Our healthcare system is sick. Over 131,000 people in Philadelphia don't have any health insurance. No protection against an illness or accident. The infection in our healthcare system leaves multi-thousand-dollar hospital bills in its wake, consumes huge portions of city and state budget, and destabilizes entire families and communities. But many understand that this infection isn't just deteriorating the healthcare system alone. It's an epidemic that stretches deep and wide, from people with disabilities to taxi cab drivers, from nurses and hospital technicians to people who work in nursing homes, from the uninsured to the underinsured, from people living with AIDS to families across the country desperate for drastic healthcare reform. The influence of profit and power affects and impairs not only the human right to healthcare, but also the human right to just working conditions, quality education, and adequate housing. MMPTV tells the untold stories of those uniting across struggles to build a movement to end poverty. In this episode, we look at the way healthcare institutions are becoming more and more inaccessible to those who need them most, why conditions of healthcare workers are impacting their ability to care for patients, and how people from different communities are uniting together to demand justice and equality in the healthcare system and beyond. We begin in Pottstown, Pennsylvania, 45 minutes northwest of Philadelphia. Pottstown used to be a steel and iron town, not anymore.
This hospital is one of the major employers here in the city of Pottstown. It might even be the biggest employer here in Pottstown, since some of the other major companies have left over the years.
PMMC used to be a not-for-profit hospital. Families and neighbors got their care in their community, whether or not they could pay. But then in 2002, it was bought by Community Health Systems, a for-profit company based in Tennessee. CHS owns or operates over 120 hospitals in 29 states. They made $10.8 billion in profit last year. So how does a for-profit company make money off of Pottstown's community hospital? As leaders in their healthcare union, Kathleen and her fellow coworkers had a lot to say about how their hospital's new owner was impacting quality care in their community.
When I first started at Pottstown, it was almost like a family that you were joining. Everybody knew everybody. We knew all the doctors' names, all the nurses' names. It was very like family-oriented. People from the neighborhood brought their family there. We got them well. They went home. They told their neighbors. They came back. But now that CHS came, it's more like it's a business. You come in, you have this done, that done, that done. There's no real friendliness to it. We've lost that compassion, I believe.
Just to see the change from nonprofit to profit is a big difference. I mean, big difference. The care of the people, to me, now it seems like a factory. Everything is money, money, money.
I feel that if you come in, you don't have insurance, as soon as they see some improvement, you're out the door. It's not that we're going to stay here and, get it rectified and find out what's really going on, and that you get the care that you really need rather than, okay, you're well enough to leave.
They do, I call it MASH care to patients that don't have health care. They get them in because the law requires them to take them into emergency. They give them quick treatment enough to get them out.
The word is stingy is the only way to really say it. I mean, we have a tough time in my department just getting equipment.
Since CHS took over, Pottstown has clamped down on so-called charity care for families that can't afford health care. And they've clamped down on workers' pay and benefits too. When the workers' contract expired in fall of 2009, CHS didn't show up for 3 out of the 4 meetings scheduled to negotiate pay and benefits with Pottstown employees. Was CHS holding off on negotiations because they were struggling to make ends meet? Not according to Roy Fike.
Even with the recession on, they will be making over $30 million more this year than they did last year. And everyone else is in a recession and losing money or just barely breaking even.
Recently, my husband took sick, and I don't know what's going to happen. I mean, is his medical bills going to be paid for? Do I have any kind of opportunity to improve his health? And I'm up in the air, and I don't know which way to go, whether to, look for another job, a second job perhaps, because I don't know where my benefits are. I don't know, like I said, who's paying the bills. So I find it very hard.
I basically was the primary breadwinner in my house while my husband was recovering from his accident. I mean, I have 3 kids. I'm not hawking the bank. If anything, I'm probably, far from that.
And what we want is for the community to be behind us and say, if you are making this profit, why do you have to take away from the employees? Why do you have to take away from your patients coming into the hospital?
With negotiations on hold, Pottstown Memorial Medical Center employees held a vigil to take a stand for their patients, their community, and their future.
Most of my parishioners go to that hospital because if I was sick or my family was sick, we would go to Pottstown Hospital. I'd like to see it to be the best that it can be. And right now it is not, because CHS has chosen to make money rather than be caring. We've gone from being a caring place to a business.
Community members came out in support, knowing that the cuts to health benefits and pay being proposed by CHS would not only hurt workers and their families, but would inevitably hurt patient care as well.
I'm going to give good health care because that's part of my integrity, and I believe everyone here will, regardless of whether we get a lousy health care plan or our benefits aren't too good. But it's a statement of how the hospital, if the hospital doesn't care about the people that work here, what makes you think they're going to care about the patient?
In healthcare, there should really only be so much profit you need to make. Healthcare is actually for the benefit of the people, not for your wallet.
With community support, the Pottstown workers finally settled their contract last fall. But from Washington State to Wilkes-Barre, CHS hospital contracts remain open, and patient care and workers' jobs are at risk. The infection that is eroding Pottstown's healthcare system will continue to worsen if healthcare institutions like CHS continue to put profit before people.
What happens when infection deepens? What happens when the company providing lifeline healthcare is ready to close your hospital to make a few dollars? Let's go back to Philadelphia to see what happened at Northeastern, a community hospital operated by Temple University Health Systems when it failed to bring in enough profit.
Northeastern Hospital was shut down in 2009 after almost 100 years. It served the mostly low-income neighborhoods of Port Richmond, Fishtown, and Kensington. We talked to members of PASNAP from Northeastern and Temple University Hospital to understand the impacts of this hospital closure and what this tells us about the spreading infection in our healthcare system.
It was a community place, a family place. People worked there for years. You got to know all your coworkers. My coworkers, most of them I worked with for 25 years. You got to know all their families, all the families of the patients that you took care of. At one point you might have the mother or the father, then some of the children, then years gone by, then next thing you know you're taking care of their grandchildren. It's a great, community family place. Not all of them have access to a car where they can drive across the other side of town, to get to a hospital.
When Temple University Health Systems began threatening to close Northeastern, Chris, with fellow members of PASNAP and several community groups beside her, fought back.
We were able to rally probably about 60 people from the community, from church leaders, leaders of organizations in the neighborhood to try to block any changes to the care, because we had heard at that time maternity probably would go, and that was something that we didn't want closed. At the time we didn't know the whole hospital was going to close. But we wondered why Temple didn't do more to try to keep the hospital open.
Many don't understand why the hospital was closed. In 2008, it treated roughly 50,000 people in its emergency room and delivered 1,800 babies. The hospital claimed to be losing money, but Temple University Health Systems as a whole continues to operate at a substantial profit. If it wasn't for lack of need, why was this community hospital forced to close? And what does this mean for Temple University Hospital, which will be absorbing patients formerly served by Northeastern? We talked to Lorenzo and Francine, who work at Temple University Hospital, to find out.
Temple seen where they wasn't making the profit that they want to make at Northeastern Hospital and felt to need, hey, we can save more money if we just close this place down and, do away with it.
We're definitely seeing an increase in volume here at Temple. I don't know whether we can fulfill the volume. I know our maternity, mother, infant, and child is really at its peak.
We delivered 1 in 10 babies in Philadelphia at Northeastern Hospital. Maternity units, as we all know, have been shutting down for years, just one after the other, closing, Northeastern being the last. Everyone knows the closer you are to the delivery room, the better chance your baby has to survive.
I know our emergency room, which was before crowded, is now really crowded. I know as far as where I work, we've gone up 11% in surgeries. And we have bed issues sometimes where there's no room at the end and people are waiting to get into a bed.
Can we really afford to lose 800 more jobs in this city? These were jobs that were already existing. I think that really, with a little effort, could have been saved, and they weren't. You know, the jobs could have been saved, and I feel lives could be saved, because I feel that people will die not having as close access as they did before.
Temple administration was willing to close a huge community hospital, cutting 800 jobs and putting thousands of lives at risk. What other dangerous cuts are they willing to make in order to turn a profit?
As the administration has changed at Temple, it seems like they became less sensitive towards the needs of the patients, and they directed their attention towards finances, cost, effectiveness, and this affects patient care.
Through the years, it's just become faster paced until you're at the point now where it's in and out.
I work on a floor that's a lung center floor. Basically, we handle lung transplant patients. We handle people with long-term obstructive diseases from respiratory issues. And it's very important that we have the needed equipment on the floors to take care of these patients, but a lot of times we can't because the equipment's not there, because they cut back on the equipment within the hospital. So that's a big challenge, trying to take care of the patient needs without the equipment that's needed. We also don't have the proper staffing. They've cut back on staffing also as well.
If you have too many patients, something eventually does not get picked up if you're managing too many patients at one time. That's our number one goal, our patients and the safety of our patients.
Quality jobs need quality care, whether you're at Pottstown Memorial, Northeastern, or Temple University Hospital. For a month in the spring of 2010, over 1,500 professional technicians and nurses with PASNAP, the Pennsylvania Association of Staff Nurses and Allied Professionals, at Temple University Hospital went out on strike for the resources they need to provide care in one of Philly's poorest neighborhoods. Carolyn Humphreys, a technician at Temple University Hospital, was there to capture the stories and experiences of her coworkers.
This is about professional dignity. It's about patient care. It's about patient advocacy. We're here for our patients. We're here for a working environment. We're here to take care of the community. And this hospital has just bussed in 800 scabs from all over the country who are here for $10,000 a week. It's going to cost them in 2 weeks what it would take to settle the contract for the next 4 years. Are we here for the money? No! We're here for what? Patient care!
About 1 week before the strike was scheduled to begin, the union and the hospital sat down for one last bargaining session. Once again, the union brought up the issue of the gag clause. Temple would not speak about it and would only say that if we want our constitutional rights, we need to go somewhere else. This is unacceptable and proves what we've been saying all along, that this strike is not about money, it's about our rights. Okay. Do you support the strike?
I do, very
You
much
do?
so.
And why are you willing to go that far?
Because Temple is trying to take things that other hospitals have in general and just not in the contract. They have freedom of speech and they can speak and advocate for their patients, and it's not a part of their contract, and they're trying to prevent us from being able to do it by putting the wording in our contract.
Right. Okay. And what do you think their main goal is? Like, what do you think is on their agenda?
To break the union.
They just wanted to gut everything. Now on, saving the union, we won 100% of everything. They were really out to not only censor us, but to, give up the union shop, give up, all of our union rights, separate the technical employees from the nurses employees. They would be in two different, contract expiration dates, but it gave us no power. All of those demands were up there until the day of the strike, and they kept them there. They were serious about them. And, at the end of the strike, they were all gone. We were able to keep our unity, keep our free speech rights, keep the union strong. That was a great victory. Another thing was this tuition benefit that had been going back here at Temple for many years, that your dependents could attend Temple and get remission or a reduced rate at different universities. This is something they took away about a year before the strike illegally.
They abruptly took the tuition remission away from me last year. I have two sons here at Temple, and it was a big assistance. That was one of the reasons why I came to Temple.
After we won that, they opened it up for everybody. So from a janitor to a manager, everybody is now eligible for that tuition credit, which is great.
Strong unions that are willing to fight for their members are rapidly disappearing from the American workplace. And left behind are people who have forgotten what it means to be respected. So that is why this strike is so important. We cannot allow Temple to become yet another graveyard for workers' rights.
My brothers and my sisters, I'm from the NAACP, and I want you to know that we're with you. And I want you to know also, we're going to win. We're going to win. We're going to win. We're going to win.
For those who don't know me, my name is Bill Gall. I'm the president of Local 22 Firefighters Union here in Philadelphia. Today I'm here supporting you not simply because I'm a union officer. I'm here because I'm a citizen. I'm a parent. And I'm here with a simple plea for understanding and fairness. To all Temple nurses and support personnel, technicians, and all of you, I have a simple message. Your strike is our strike. Shut this operation down.
So what do you think actually helped us the most in winning?
All of us outside. Temple never expected to have as many people outside, and they also never expected to have as many people stay on strike for that long of a time period. To have more than 94% outside, that was significant to them. They thought that they were going to have more people go in, and it didn't happen. They thought that our picket lines wouldn't be strong, and they were. They thought that our solidarity was going to falter, and it never did.
What would you like to say to all your coworkers who stood in there and did it?
I think that I am the most proud of them, especially when I saw them walking in the rain on the rally on April 21st, and we covered the whole entire four corners of Temple. That was the most proud moment that I have ever had, and I don't think that all of that was rain that was on my face that day.
Solidarity forever. Solidarity forever. For patients and their wounds and make them well. From injections that the doctors are, answer every bell. Our skill and love for patients is what we're here to tell. For the union make us strong. All right. Solidarity forever. Can't hear you. Solidarity forever. Solidarity forever. For the union. The parts to collecting millions while staffing us to life. Till we give our pet for patients food, they will be alright. For our families and our hospital, we're standing up to fight. For the union makes us strong. Alright. Solidarity forever. Solidarity forever. Solidarity forever. And the union makes us strong. One time. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong.
The infection of profit in healthcare doesn't stop at the acute care we provide at our communities and regions hospitals. In nursing homes, where thousands of people get the long-term care they need, healthcare workers are fighting to put nursing home residents first. When the nursing home workers of Broomall Presbyterian Village in Broomall, Pennsylvania formed their union, they were thrilled at the prospect of enjoying the wages they needed to support their families and of having the supplies and time they needed to provide the best quality care. Sharita Rollins, a certified nursing assistant at a nearby nursing home, interviewed the Broomall workers on their victory and what they hope to win for the residents and themselves.
I feel great. I always wanted the union.
Yesterday marked a victory for caregivers and working people at Broomall Presbyterian Village Nursing Home in southeastern PA. Certified nursing assistants, housekeepers, dietary workers, and other employees won a vote to form a union at Broomall. Sharita Rollins, a certified nursing assistant and member of SEIU, interviews the new union members after the vote.
Congratulations on your victory for your union. How long have you been at Broomall?
I've been working with Presbyterian for, let's say, 20 going to 21 years. The employee of Broomall, most of the employee of Broomall put together to have somebody to talk for us because we don't have a voice.
What do you expect to get out of your contract?
We want lower health care, better raises for the residents, more linen, more, things of that nature for them. A secure pension, better working conditions.
Something recently happened, no investigation, they walked them out. People that have been working 9 years in the company, 15 years. When something happens, investigate before you can take action.
We definitely want respect.
The workers at Broomall Nursing Home will be joining the Service Employees International Union, SEIU Healthcare PA, and are now set to enter their first contract negotiations. From Media Mobilizing Project, this is Brian Mercer and Sharita Rollins.
Sharita also had a lot to share about what it was like to form a union in her own nursing home and why it has been necessary for her and her co-workers, as well as the nursing home residents that they take care of.
My name is Sharita Rollins. For 12 years at the CNA. My co-workers and I decided to form a union because we got tired of being disrespected. We needed to have some kind of security for when we retired. We didn't have anything. A lot of us gave a lot of years of service, but we didn't have anything to look forward to. We needed better health benefits. The health benefits was very high. I couldn't afford to pay health insurance for, I'm a single parent, I couldn't afford to pay health insurance for my son and I. It was like I was just working to pay health insurance.
My name is Lee Haman. A lot of things happen and you need someone to stand up and speak for you that knows the technicality. So it's a good thing to have. Well,
Why should they form?
the one thing, they need to unite, they need to be strong, they need to just stick to one another because it will help them out in the long run. Everyone needs this type of protection. It's just like having insurance. You pay for your insurance for protection when things happen. It's a coverage you have already. So you need the union because a lot of things happen where in your workplace and you don't know, the technicality or how to get out of certain things, but you need some type of leadership. So and the unions are very strong. They're very strong. So it's a good thing to have. So.
Come in.
Jackson.
Hi.
How are you?
Good, thanks.
I'm here today to talk to you about a raise. Me and my coworker decided that we deserve to get a raise.
I'm sorry, it's out of my hands. There's nothing I can do about that.
Well, I believe that that's the reason why that we're having such a big turnover in our staff, because a lot of people is not happy and they're leaving to go places where they can get raises and more money because they have to raise their families.
Well, look, there's not really anything I can do about that. I'm sorry. We just built that new wing and there's just, my hands are tied. Sorry.
Okay, thank you, Ms. Jackson. Ms. Hawkins, how long have you been working at Hereford?
16 going on 17 years. We wanted to change. We were looking forward for like a better future and just looking for like some retirement, in order after like when we retire or whatever. We didn't have anything to look forward to basically. So with a union that'll help out with that as far as that goes. Our bonuses was taken away, and we haven't got a raise within like 5 years too. That's another thing.
Please.
Oh, my name is Ann Mundy. And we see different changes and no one wants to offer a pension, so that is something we are looking forward to. Seeing it's just a small facility, just 2 buildings, but at least people should still be able to work hard and get some money. That was very hard to get everyone to decide that they will vote for the union. They were sending letters home. Some of them were telling us that if you get in the union and you want to get out, the union, you will sign, the union won't let you out, the union can't do anything for you. Basically, they were saying, what we have now is what the union offering, so why do we want a union? In the letter, they were saying, you're already getting 3 weeks vacation if you work 5 years. The union is not going to give you that, so why do we really need a union? See changes in the way they speak to us. I think we have a lot of racial issues going on here underneath the politics that goes on in here. I just want to come to work, do my work and go home. I don't want to have if someone don't like me because they just don't like me, that they're trying to set you up. There's a lot of setup going on. So I want it to be a professional place because right now, I don't think it's professional and we all have our little gossips and little cliques going on. So that needs to stop.
Come in.
Hello, Ms. Jackson.
Hi.
My coworkers and I are here to talk to you about getting a raise.
I'm sorry about that, but money's just really tight right now. We just built that new wing. I can't. I'm sorry. 6 months from now, maybe we can have another conversation.
Well, in our contract, it says that we're due a raise every 6 months. Okay, because we held up to our end of the bargain, so we think that you should hold up to your end of the bargain.
This is a good point. I guess we're going to have to sit down at the table and make some negotiation.
Okay, thank you. It was hard because a lot of my coworkers, they didn't know anything about a union. The only thing that they knew about was what the boss told them. And the boss made it seem like the union was the worst thing in the world to have. They would stress to them that the union is going to take so much money out of their check. And I would say that sometimes you have to come out your comfort zone and do things that you never done before in order to make a change. As long as you and your coworkers stick together, everything will work out fine.
Quandisha Cooper, a certified nursing assistant at another Philadelphia nursing home, fights for the same quality care every day. As a leader of her union, she knows that the best way to fight for quality health care is to realize that as patients and providers, our voices matter.
Quandisha Cooper. I'm now a member of SEIU Healthcare PA. Back in 2007, we decided to form our union. It took us about a year and a half to really sign our contract. Throughout that time, management tried to manipulate us. They tried to discourage us from forming our union. We are new as workers of dietary, nursing, and housekeeping that we needed this union for our protection. We fought and fought and fought, and finally 2008, October 10th, is when we ratified our contract. We now are coming up on our 2 years, and we are going to negotiate our contract again. Since then, we have had more respect, better wages.
How you doing? My name is Donnies Hunter Manning. I work for Chapel Manor Nursing Home. I'm a restorative CNA and also the union's vice president. The reason why I'm glad that we formed a union because now our opinions really matter. Before we got the union, management did not pay us no mind. What we felt and what we said had no regards to them. But now that we are a union, everything we say matters.
Hi, my name is Darlene Morgan, and the one thing that I like about having a union is that we have a fair fight in whatever we want, and the most important thing is that management can't push us around like they were doing, and the union is the best thing that we could ever have.
Hi, my name is Brenda Rogers. I'm in the dietary department. A lot has changed. A lot of respect is in the building now. It's a lot that wasn't here before. It's a lot better.
And a better working environment. I'm here today to tell you that it's very important to have a union inside your facility. Everything is totally different from having a union to not having a union. Everybody is treated equally and respectfully. So don't be afraid of management. Don't let them discourage you or deteriorate you in forming your union. This is very important to you, the lives of your family, and your working environment. So I'm here as a union member and an employee. Stand up for your rights because your voice does matter.
While Quandisha and Sharita organize their co-workers to provide the best long-term care they can, Antonio, a leader of ACT UP Philadelphia, which uses powerful community organizing and direct action to end the AIDS crisis, speaks out for the resources people living with HIV and AIDS need to lead dignified lives.
Hi everyone, my name is Antonio Davis. I'm here at Temple University Hospital. Every 3 months I come and get a checkup to see how my CD4 and T-cell counts are. And today I'll be getting my results and hopefully everything goes well.
Viral load undetectable.
Yes.
Okay. So it sounds like you're doing good. Did you have any concerns today?
No, not at all.
Pretty much just coming in for lab work and routine.
Yes.
Your last labs was in September. Does that sound right, or have you had a recent laboratory work?
Labs was in September.
Okay, so probably due for some work today?
Yes, today.
Okay, and last time C4s were 543. Great.
I'm here with Jose DeMarcos, a historian who has been fighting the AIDS crisis since 1991. What was going on then, and how did you actually start fighting for the AIDS crisis?
Actually, when the AIDS epidemic first hit this country, it basically was hitting white gay men and gay men. I became personally involved because my partner contracted HIV, which quickly turned into AIDS because there were no treatments, life-saving treatments available during those years. What medicines were available basically treated symptoms, but they did not do what the current medications can do now. The medications were exorbitantly priced if you did not have insurance or access to health insurance. The medicines were out of reach for most people, and those that could afford them, they soon quickly became poor. It took AIDS activists, namely a group, ACT UP, like ACT UP New York, ACT UP Philadelphia, ACT UP San Francisco. We knew that there were drugs available in the pipeline, and some drugs were available through clinical trials. But groups like ACT UP and AIDS activists compelled the federal government to change their waiting period. Most drugs had a 7-year waiting period and trial period, which was cut down to actually 2 years because of AIDS activism. Big emphasis right now placed on prevention, but prevention goes hand in hand with treatment. If you treat people that have HIV and AIDS, they become less infectious. People don't realize that.
My name is Kate. I am with ACT UP Philly, the AIDS Coalition to Unleash Power. The city government just let service agencies know last week that they're, in Philadelphia, there's a $1.7 million cut in prevention services for this year, which actually this year started on July 1st. So it's money that folks have already been spending. And have already budgeted out and, have hired people and bought supplies and made programs based around having money that now they just were told there's a lot less of. They also were told that there's a $2 million cut for the following year as well. So I don't think we know exactly how that's going to work out right now, but it's pretty scary anymore. It's not a priority, and so when there's not a lot of money, money's tight. At the end of the day, we don't actually care. We don't care about preventing HIV, and we don't care about people living with HIV.
When you think that this is a global pandemic, that people are dying daily, they're sick, they're suffering, and they don't have to die for lack of medications because the medications are there, they're available, and they can be made cheaply.
Because with each year there's more and more people living with HIV and AIDS, so if we get the same amount of money as we did last year, there's more people, that means there's less money. So even when it's flat funding is actually not enough money to do even what we were able to do last year.
I'm really disturbed that President Obama is not seeing this.
To cure the epidemic in healthcare, we need to speak out together to win the resources our lives depend upon. That's exactly what taxi drivers have been doing in the campaign for workers' compensation. They're fighting for much-needed compensation for drivers who become sick or injured on the job. This is an excerpt from Driving the American Dream, a short film produced in partnership with the Unified Taxi Workers Alliance of Pennsylvania.
He went on a call. It was on McCullen Street. When he got out of the cab and he went to, I guess, open the trunk or walk, somebody came behind him and stabbed him in both lungs. He saved his own life because his last words were on the radio to John saying, "I'm bleeding to death." And that's when the ambulance got there. Financially, it's horrible. And his prescriptions, he takes quite a few medications. He takes at least 25 pills a day. And like I said, the co-pays I have to pay. His doctor comes to the house once a month. And he does need a specialist, like he needs some things done. And this man has to live with this every day. Every day of his life, he has to live with this. And it's I mean, I know how I feel. I can't imagine how he feels. He's such a smart man. He has everything up here, but it won't come out of his mouth. This is our life right now. There's no change in it. There's nothing. It's just our life. And like I said, when they do something like this, it doesn't only affect the victim, it affects the whole family.
This is the most dangerous job in Philadelphia. By every standard, it's the most dangerous job in Philadelphia. We need some relief, injury relief, when we're injured on the job or we suffer any kind of medical problems. That is very, very important for us to be able to sustain this industry and for us to survive. And the drivers who are at the point of attack, so to speak, need to be healthy. They need to be able to have something to resort to when they have a problem. And that is why it's so vital. And it goes round. Everything can be tied together. I mean, if the drivers are healthy and they know that when they're injured, they can get help, you know. I mean, their mind is free and they'll be able to do their job better. So some drivers hadn't been to the hospital in a long time because they don't have the money, they don't have the insurance, they don't have anything, you know. So they just suck it up every day and come back to work. You don't want a driver who is very sick, but he doesn't have a choice but to walk, to be driving you on the street. That is why this workers' compensation thing is very, very important, and it's needed for the safety of the driver, for the safety of the city of Philadelphia, for the safety of all the passengers who pick up.
In order to truly address this epidemic, we must deliver the most powerful dose of medicine possible by uniting together. Let's see how people with disabilities and taxicab drivers are supporting each other's fight for fair healthcare and fair transportation in our city.
Taxi drivers and people living with disabilities have been working together for years to bring accessibility and basic health protections to the taxi industry. This March, a hearing discussing the proposed legislation brought them one step closer.
This bill is about basically an issue of equity and fairness. It is unconscionable that members of the disabled community cannot access modern public transportation. It must be made open to all members of the community in Philadelphia.
In the early 2000s, a previous bill was presented that would create accessible taxicabs in Philadelphia, but was vetoed by Governor Rendell. The first part of the House Bill 1914 addresses the issue once again, demanding the creation of wheelchair-accessible taxicabs. Members and employees of Liberty Resources, a nonprofit, consumer-driven organization that advocates and promotes independent living for persons with disabilities, gave personal testimonies about their experience using Philadelphia public transportation, the discrimination they face, and reasons why the bill should be passed.
Getting to work for any person can be difficult at times, but for a disabled person, it is more so because of the rudeness of the public. There are times when I get on the bus in my power chair and I am assaulted with a barrage of bad attitude.
But most of all, I need it personally because I have a daughter with a heart condition, and I am scared to death sometimes when I go home if she's not well. What am I going to do if she has to go to the hospital tonight? Because I want to go with her. I'm in a motor chair. I'm not going to send a 9-year-old in an ambulance without her mother. That would be preposterous. But yet, I'm always at risk that she'll end up being taken in an ambulance and I'll have no access to that hospital with her.
This bill represents a power partnership between passengers and taxi drivers, who not only want to offer expanded service, but also ensure drivers have the care they need. The second part of the legislation demands that taxi cab owners should provide workers' compensation benefits to taxi cab drivers who are injured on the job.
It is unconscionable that if you are injured on the job, that same job does not cover you for your care.
Currently in Philadelphia, drivers take home an average of $4.17 an hour. Based on this, drivers argue the cost of workers' comp should rest on the taxi cab owners they lease the vehicles from. The Taxi Drivers Alliance was present to present their concerns and reasons why the bill should be passed.
Why is workers' comp important for the drivers? Well, according to OSHA, taxi drivers are 60 times more likely to be killed, 80 times more likely to be assaulted on the job than any other occupation.
We had a member 2 years ago who was robbed at gunpoint. After he turned the money over, he was shot in his right eye. And Noymar Branch to this day remains blind in his eye. He could not go back to work. It was workers' compensation that allowed his family to keep up their basic bills.
Over everything, over the independent contractor, over everything. It's the public interest, the public safety should override all this stuff. So if my mother gets in the back of a cab and the driver has a slip disc, anything can happen. This is so important.
When we say accessible, we mean them to be accessible on every single level, whether it is to the person in the back seat or to the person in the front seat.
Majority Caucus Chairman Mark B. Cohen was present at the hearing and supports the bill. The concern by people most familiar with the bill is that similar bills have failed in the past and that it will be opposed by the Republican State Senate, though there is strong support in the State House. House Bill 1914 still remains in the House Committee on Urban Affairs headed by Republican Curtis Thomas.
Your support, all the people here, will be very, very helpful in getting this legislation taken seriously and getting enacted.
Whether it be equitable transportation for people with disabilities or equitable access to health care for workers on the job, people are coming together to demand justice. Many working people across the country have united across color lines in a common struggle for equitable access to health care. While health care as a whole is changing with the passage of the National Healthcare Reform, we know that millions will still go without the care they need and it will remain unaffordable for many. Money is still part of the infection. We go now to Vermont, where a huge movement is working to cure the problem once and for all by changing the law to guarantee health care as a human right.
My name is Michael Markoff. I've been without health insurance for 20 years.
These people are dedicated members of the community that don't have insurance.
I do not want to have to justify to insurance companies that I want better quality of life and have to tell them, or have them tell me it's too expensive.
I've gone for an MRI, which I debated on for so long, and have the bill for that, and the bill for this and that, and a whole bunch of other things sitting on my kitchen table at home.
What I find so frustrating about my job is that probably at least 50% of the patients that I take care of never should have ended up in the ICU.
I can't afford treatment if it is serious. If I go and find out this is cancer, I've essentially bankrupted my family. On the other hand, if I don't go get treatment and it's cancer, I've left them without a dad.
As a self-employed carpenter struggling to make ends meet for many years, I had to choose between being homeless or having health insurance.
I just can't afford them. You do the math, and the money's just not there.
Having to choose between their kids' college education, mortgage, heat, it's just devastating.
I do not want to have to choose between buying medicine and buying groceries for the week.
And suddenly we were part of what I guess is called the underinsured.
It's hard enough emotionally, physically, living with pain every day without having to worry about how I'm going to get out of debt.
I am not a price tag. I am not, the value of my life is not a tax burden.
They come in for infections that they noticed possibly a week or two before, but delay care because they already have overwhelming medical bills.
The deductible was $5,000. That meant that we had to spend $13,000 before we would ever get a cent of reimbursement?
Before I knew it, I was medically bankrupt.
I've seen people with diabetes, even well-managed diabetes, that ignore small ulcers on their feet that are easily treatable, but they can't get treatment for because they don't have insurance, and they end up losing their foot, sometimes their entire leg.
Tens of thousands of people are suffering, dying, and living in fear needlessly every year.
That a healthcare system based on corporate greed has given us all too much human suffering.
There is no question that the system that we have now is broken. It's fundamentally broken, and it's a mess.
It must not be that you're at the doctor's office and you're trying to figure out how to pay.
I'm here because this is my reality. This is what I deal with, and I'm here for everyone else who's dealing with it too.
Our problem is that we're spending money for profits, for bureaucracy, for advertising, for billing. We're not spending it where we need it for doctors, nurses, medicine, healthcare professionals. We've got to change our healthcare priorities.
Now, we need a rational way to finance healthcare. Each of these insurance companies has a different rules, reimbursement, and regulations. And this is just one primary care office. Now, you can imagine why, with all of this, we spend an enormous amount of money on administration.
Our current healthcare financing system, based largely on employer-sponsored private insurance, is unsustainable.
We need a system that puts providing this care first. Healthcare is not a commodity, but a public good. We look at our schools as a public good, our police departments, our fire departments. Why is it that we can't look at healthcare in the same way? We say we can and we should.
The current system of market-based healthcare financing cannot merely be tweaked piece by piece because it has the wrong goal.
The function of a private health insurance company is not to provide health care, it is to make money. And that is the system that we have got to end.
What do we mean when we say that healthcare in particular is a human right?
Here we have some 5 principles that we feel that comprise what having healthcare as a human right is about.
Universality, equity, accountability, transparency, and participation.
A healthcare system that satisfies these principles is the responsibility of government to ensure.
The goal of the Healthcare as a Human Right campaign is to witness, in practice, meaningful healthcare reform that embodies the human rights principles that have been just described.
We would like to see the right to health care embedded in law.
Face-to-face, grassroots organizing is the only way we can ever leverage enough power to beat their money.
To seek health care is a human right. So we have this campaign that means to take health care as a human right out of the abstract and move it into the concrete world, as health care is a human right by Vermont law. That is our goal.
To make this a reality in our country, we launched the campaign about 1.5 years ago with a series of hearings. Some of you folks may have been at those hearings. We also did surveys and collected stories from Vermonters about how the healthcare crisis is affecting all of us. On May 1st of last year, we held the biggest weekday rally in the history of the state, where over 1,000 Vermonters came out to the State House, flooded the State House with supporters.
Now is the time to demand that our government do our will without interference from any corporation, and they must create a real healthcare system. Healthcare is a human right.
It is time for Vermont to lead the way.
I think that if the state of Vermont does the single-payer system well, as I know we can, you're going to have New York State, New Hampshire, Connecticut, every other state in this country looking at us, wanting it, and then you're going to have a national single-payer program.
And what we heard loud and clear in communities across Vermont is that the time is now for change on health care.
elected representatives to recognize, as the people of Vermont do, that health care is a human right.
Not just politically possible, it's politically inescapable.
From Vermont to Pennsylvania, Philadelphia to Pottstown, the backseat to the front seat, the nursing home to the hospital, patient to caregiver, it will take all of us fighting together to root out this epidemic of corporate profits trumping human needs. The influence of profit and power that seeks to obscure our basic human rights can only be addressed by building the same kind of far-reaching power from below. The Media Mobilizing Project is a network of community organizations and leaders building a movement to end poverty led by the poor. Too often, the people of our city and beyond stand alone in silence, divided and isolated. And so, through radio, the internet, and TV, we seek to tell the untold stories of Philadelphia and beyond, because movements begin with the telling of untold stories. Until next time, you can find updates live on the web at MediaMobilizing.org. I'm Miguel Andrade, and thank you for watching.